You are welcome to my channel. Thanks for visiting. Today, I'll be limiting myself to withdrawal signs and symptoms of Meperidine. You are familiar with the brand Demerol? No problem. Let's go. Let's take note of the fact that this is not expected to kill you, but it could be very unpleasant. It is better to seek help, like detoxification or rehabilitation, and that will help tremendously. Also remember that no two people will be exactly the same. Still under the first note, the severity of the withdrawal signs and symptoms will be based on how high the dose of meperidine you've been taking. For how long have you been taking it? Has your body adjusted to it? Are you taking it with other substances? How about your health status generally? Do you have psychiatric disorder? Have you developed tolerance to it? Are you dependent on it? Have you been abusing it or are you addicted? All this will determine the level of severity of the withdrawal signs and symptoms. Also, the first phase of withdrawal signs and symptoms will be the first 10 days, and this is called acute withdrawal symptoms. The second phase will be days after the 10 days. That will be post-acute withdrawal symptoms. Post-acute withdrawal symptoms can last 2 years or more. The expectation is that the intensity will be inversely proportional to time. Let me explain. The longer you are from the day you stopped, the lesser the severity of the signs and symptoms. Now, let's go through the sequence order. I place this as order A, the first thing that will happen. The fact is you are already on Demerol, but you stopped, either you stopped cold turkey or you've been ordered to stop gradually. The first 2 to 5 hours of throughout the day, something will happen. You'll still be craving to have the medication. You'll still be craving to have Demerol or Meperidine. There will be efforts that you are going to put into it, and you are going to seek to get the drug to be used by all means, including stealing, begging for money to get it bought, going to doctors to tell lies to get it. Then you can have nausea, vomiting, runny nose, shortness of breath, your blood pressure may rise, can become irritable or agitated. You become restless and having difficulty to sleep, and you might even become anxious. The sequence order B will be that at 48 hours, that is 2 days to 5 days, you'll still be craving to have the drug and you'll be seeking to have the drug by all means available to you. Your body will start reacting at this time, and that will be muscle pain, headache, chills, you'll be sweating profusely, you'll have dry mouth, become apprehensive, and you can have hallucination or become paranoid. You can have shortness of breath with all other factors under sequence order A. The sequence order C is that at day 6 to 10, acute withdrawal symptoms will end this time. Then everything under sequence order A and sequence order B will be waning in intensity, meaning the symptoms are no longer as severe as the first day to day 6 up to day 10. No, it will be going down. But you still be craving to have the drug and might be seeking to have it as well. Now sequence order D. At day 11 and greater than that, you will then be faced with post-acute withdrawal symptoms, and that will start. Then you can become depressed with characteristics of depression, and at this stage, we have to watch out for suicidal ideation or attempted suicide. This is the stage that some people might, kill themselves, become, paranoid, and then be having hallucination. The expectation is that the intensity of the above will be low and will continue to abate as the day goes by. Hence, the intensity will become inversely proportional to the length of time, meaning as you go from day 11 to day 20 to 40 or 50, you might still be having the signs or symptoms, but it will be waning in intensity. I tag this as sequence order E. At this level, the expectation is that you are going to get out of all this trouble if you seek help on time. You seek help quickly, then please, if that is your choice, which is the expected choice, and that is why I'm here to publish this, then talk to your doctor. Go to the emergency room. Call 911 or 119, 999 or 112, depending on where you are in Europe, North America, Latin America, Africa, Asia, anywhere you may be. But if you want to get out of this trouble after seeking help, calling the appropriate number, or going to your doctor, don't secretly indulge yourself in taking any other drug, please. I mean, street drug. No, don't. The sequence order F will be that you might give up the ghost. That is not expected, but it is possible if you are secretly taking the drug or other drugs. I mean, street drugs. Then, if you are not seeking help, or you are seeking help but you are not, uh, adhering to the instructions, non-compliant with intervention, rehabilitation, or detoxification, that you are attending or you sign up for. If you are deceiving yourself, you are going to die. Suicidal ideation, if you have it and it's not reported, then you are going to die. So when we find out that you have suicidal ideation or attempted suicide, we are going to address it promptly. So if you have suicidal ideation or attempted suicide and the physician is not addressing it promptly, you are going to die. Please seek help. Seek help. We want you here. Your friends and family members want you. Seek help. Seek help. No more secret drug, ingestion. Don't do it anymore. Seek help. Go for rehabilitation. Go for detoxification. Seek help. Your family, your friends love you. Thanks for this short presentation. Kindly forward this to anyone you know that will need help. Appreciate it.